welcome back again to yet another episode of the Legal Skeptic. Today I'm going to talk about something that's a little bit near and dear to my heart. Mainly the fact that yesterday, on the 22nd of November, the House of Representatives in the United States passed healthcare reform. Now, I've heard a lot of garbage today on the radio about what this healthcare reform really is. So, let's look at it for a few seconds, shall we? What's going to happen this year? Because Obama's signing it tomorrow on the 24th. So what's going to happen this year for healthcare reform? Well, first off, the insurance companies are going to be barred from dropping people from coverage when they get sick. And lifetime coverage limits are going to be eliminated, and annual limits are going to be restricted. Which basically means what? Well, first off, if you get sick, you don't lose your insurance. If you have to go to the hospital with a terminal condition, you don't lose your insurance. You don't have to mortgage your house to pay for your illness. Insurers are also going to be barred from excluding children from coverage because of pre-existing conditions. Now, what does that mean? It means if your child has asthma, and currently your insurance company says, oh no, we can't cover him because he's got asthma. That's a pre-existing condition. They won't be able to do that anymore. Young adults are going to be able to stay on their parents' health plan until they're 26 years old. Now, currently a lot of health plans drop people from coverage when they either turn 19 or when they graduate college. They can't do that anymore. You can cover your children up to 26 years of age. Uninsured adults with pre-existing conditions are going to be able to obtain health coverage through a new program that is going to expire in 2014 when the insurance exchanges come into effect. And I'll talk about the insurance exchanges in a moment, because we're still on this year, 2010. So a temporary reinsurance program is going to go into effect, which is going to help maintain companies' health coverage for elderly retirees. This will also expire in 2014, and these are people 55 to 64. Medicare drug beneficiaries who fall into this donut hole, as they call it, are going to get a $250 rebate. Now, eventually this donut hole is closed. The donut hole begins after you've spent $2,700 on prescription drugs, and then you're on your own between $2,700 and $6,154, at which point your coverage picks up again. This is going to close that hole. There's going to be a tax credit for some small businesses to help provide coverage for workers, and there's going to be a 10% tax on indoor tanning services that use ultraviolet lamps, which goes into effect on July 1st. So that's what happens in 2010. Now tell me, how is this bad? I don't understand. So we now move on to 2011. So in 2011, what happens? Well, Medicare provides a 10% bonus payments to primary care physicians and general surgeons. They get more money. Medicare beneficiaries will be able to get free annual wellness visits and personalized prevention plan services. This will help you stay healthy. A new program under Medicaid, specifically under the Plan for the Poor, goes into effect in October of 2011, which will allow states to offer home and community-based care for the disabled that otherwise would require institutionalized care. This will save immense amounts of money. Payment to insurers offering Medicare Advantage services are going to be frozen at the 2010 levels. Now, these payments are going to be reduced to bring them in line with traditional Medicare. Employers will be required to disclose the value of your health benefits on W-2 tax forms. This might sound bad, but in reality it's not. You're going to wind up getting taxed anyways. There's got to be some method of paying for this, but it doesn't take effect until 2011. And realize they're listing what the benefits they provide are. The annual fee is going to be imposed on pharmaceutical companies according to market share. This fee does not apply to companies with sales of $5 million or less. I work in pharmaceuticals, even I think this is a good idea. So now we're up to 2012. Physician payment reforms are implemented in Medicare to enhance primary care services and encourage doctors to form accountable care organizations. This will make care better. There's going to be an incentive program for Medicare for acute care hospitals to improve quality. Again, the quality of the service is going to increase. The Centers for Medicare and Medicaid Services, which oversee the government programs, are going to begin tracking readmission rates and put in place financial incentives to reduce preventable readmissions. Once again, the purpose of this is for a healthier America. 2013 we're up to now. There's going to be a pilot program for Medicare on payment bundling to encourage doctors, hospitals, and other care providers to coordinate patient care. The threshold for claiming medical expenses on itemized tax returns is raised to 10%. The threshold remains at 7.5 for the elderly through 2016. Medicare payroll tax is raised to 2.3 from 1.45 for individuals earning more than $200,000 a year and married couples with over 250. So, yeah, once again, we have to pay for it somehow. I understand that people don't want to pay for it, but think about it. The quality of the service, the health care that you're getting, will be drastically improved. A 2.9 excise tax is imposed on the sale of medical devices. This will not affect anything that's generally purchased at the retail level by the public. So now we're in 2014. So state health insurance exchanges for small businesses and individuals open. Great! This will be a way to pool and collectively bargain your insurance. Now, most people will be required to obtain health coverage and pay a fine if they can't, but there will be health care tax credits to people with incomes up to 400% of poverty purchase coverage on the exchange. In other words, if you're poor, we'll help you get coverage. Health plans can no longer exclude people from coverage due to pre-existing conditions. If you have a pre-existing condition, your insurance companies cannot deny you based on that. Employers with 50 or more workers who do not offer coverage will face a fine of $2,000 for each employee if any worker receives subsidized insurance on the exchanges. The first 30 employees are not counted toward this fine, however. Health insurance companies are going to begin paying a fee based on their market share. Now we're up to 2015. Medicare creates a physician payment program aimed at rewarding quality of care rather than volume of services. Think about that. Quality of care. Not how many people you treat, but how well you treat them. And in 2018, there's going to be an excise tax on high-cost employer-provided programs. And the first $27,500 of a family plan or $10,200 for an individual is exempt from this. And there are higher levels set for retirees and people in high-risk professions. This is the health care that was passed on Sunday. This is what the Democrats want. This is what the Republicans are opposing. The Republicans keep yapping on about abortion. Nothing in here about abortion. Zero. That's the cat. Zero in here about abortion. This is what you have to realize when you see these different plans being discussed. Your health care is important. You should understand what it is that was voted on. This is it. This is the health care that you now have. I'm the Legal Skeptic. Have a wonderful evening.